My name is Dr. Joe Borelli. I'm an MRI specialist and operate and own a freestanding MRI facility in Bluffton, South Carolina called MRI at Belfair. We've been operating since 2003. We installed a General Electric 3T MR750W scanner in 2013. We've been using OnQ Prostate and NeuroQuant since their inceptions, respectively. We've been incredibly successful over the years, competing with about 8 different facilities in the market, including several hospital-owned facilities. And a large part of our success I attribute to the fact that we were the first to offer NeuroQuant and OnQ Prostate. And since that time, we have been the definitive leader in terms of the workup of cognitive impairment and elevated PSA. We've been delighted with OnQ Prostate and NeuroQuant over the years, delighted with the product support and ongoing product development of the Cortechs.ai team. We strongly endorse the products, and we think that you should also strongly consider NeuroQuant and OnQ Prostate for your practice if you're considering them. I was at the RSNA, I think it's about 15, 16 years ago, and Cortechs.ai was a new company, and they were demonstrating NeuroQuant, which was using AI to segment the brain rather than the manual method of having a technologist segment the brain by hand, slice by slice. And they were showing the NeuroQuant product, which was measuring the hippocampus and comparing it to standards and allowing us to diagnose progression from MCI to Alzheimer's disease with great accuracy. And I immediately saw that this would be a breakthrough product. It was going to be transformative for healthcare. And we have a large retirement community nearby, Sun City, Hilton Head, which is nearby. And it's been an amazing story. We started out, doing maybe a few a month, and now we're doing several per day of NeuroQuant. When we are working up patients for cognitive impairment, we are routinely being asked to perform NeuroQuant. It's become the standard of care locally and in the region. So I very rarely see a referral for an MRI of the brain that does not have the additional request for NeuroQuant processing. So it's part of our daily workflow for sure. It's something we use on virtually every patient that has cognitive impairment. In the last several years, we've had patients that come back multiple times, 2 times, 3 times. And obviously the processing is done offline. So we send the images off. They come back very promptly in about 10 minutes. So we actually run that first. So we run our 3D T1 scan as 3D T1 Bravo on the GE systems. And we send that off, and it comes back within about 10 minutes. And we're actually reviewing it and confirming that it's processed correctly, which it does at least 99% of the time. And so before the patient leaves, we know we have a good quality result from NeuroQuant. We're seeing patients that are coming back for their second or third exam, and we can actually track the rate of hippocampal atrophy, which is probably even a more specific marker. So if we have someone that's like borderline clinically and borderline via NeuroQuant, we have them come back in 6 months, maybe 12 months, and we look at the rate of atrophy of the hippocampus. And if it's significantly over 1% to 2%, that's another very strong indicator that Alzheimer's disease is the cause of the cognitive impairment. So it's really fundamental. It's transformed our practice. It's transformed, I think, the clinical practice for cognitive impairment locally. It's been a huge benefit to the community and our aging patient population here. When they request NeuroQuant, I'm demonstrating the NeuroQuant results to them, the beautiful charts and graphs that come up. They get it. It's very easy to see the point on the chart showing their age versus their peers. Another important aspect of the product. I think someone in their 50s, maybe 60s, even without cognitive impairment now, I think it's really helpful to get a baseline and get a measurement, a baseline of mostly the whole brain and hippocampal volumes and the other segments, which may become helpful down the road as AI continues to overlay and look at these different aspects of the brain and aging. So yes, we do review the NeuroQuant reports with patients, typically when we're performing whole body MRI screenings. It's a very important part of that, part of the workup. And patients are very much interested. You can see their eyes really light up when they actually see where they score compared to their peers, their age-matched peers. I think it's probably one of the highlights of the whole consultation we have following high definition whole body MRI screening. The benefits of Cortechs.ai products for referring physicians are really the ease of which you can interpret the results. A picture is worth 1,000 words. When you have graphs, for example, from NeuroQuant that clearly show, on a chart compared to, aged matched peers, where the patient lines up on their either whole brain or hippocampal volumes or hippocampal occupancy score, it's very easy to communicate that. It's very simple. And same with OnQ Prostate, you have this restriction spectrum imaging overlay over the T2 weighted image. It basically shows in purple any positive findings. Very easy for the referring physician to grasp that. So it really, is a much more effective way of communicating findings, graphically rather than the report. They probably just immediately go to the images than to the report. Of course, when we give a result with OnQ Prostate, what the PIRADS result is, of course, that's important as well. But then if it's positive, to actually see, very simply with a color overlay where the lesion is, and that aids with, subsequent biopsy and treatment. Since adopting Cortechs.ai products, including NeuroQuant and OnQ Prostate, we've become the de facto center of excellence for neuroimaging and prostate imaging in the region. Scan volumes have increased dramatically, both for brain imaging and prostate imaging. I would say that virtually every patient with an elevated PSA, the vast majority, maybe 80 to 90%, are coming to us for evaluation for PSA elevation. The same is probably true, probably even a higher percentage regarding cognitive impairment. Despite the fact that we're independent and unaffiliated with any of the hospitals, the hospital-based physicians are referring patients for both NeuroQuant and OnQ Prostate. So it's quite transformational. We dominate in other areas as well, but with the Cortechs.ai products, we actually are even a further step ahead in terms of, if you would want to call it competition. We've been using NeuroQuant for, I think, at least 15 years. And since adopting NeuroQuant and making that available to our referring physicians, I think we've probably seen at least a doubling or tripling of our referrals for brain imaging, despite the fact that, brain imaging is one of the most common indications for MRI, brain and spine, obviously musculoskeletal applications, but it's been a huge growth driver over those 15 years. The same with OnQ Prostate. We were probably doing maybe 2 or 3 exams for the prostate per week, and now we probably do more than that per day now that we've added OnQ Prostate to our prostate imaging protocol. The surgeons are finding a very close correlation with our findings and biopsies. We're frequently finding lesions in patients that were biopsy negative, which is, really proves the benefit of the technology. There's several reasons why I would recommend Cortechs products. First of all, Cortechs.ai, they were the leader. They were the first to utilize AI to analyze and segment the brain for Alzheimer's disease patients. They then, have developed additional products, including OnQ Prostate, which layers on top of that experience. Cortechs.ai has been very reliable, very cost-effective. I don't think we've ever had any issues where we couldn't process a study. The uptime has been incredible. I would say that, if someone's considering Cortechs.ai products, I would put them in the leadership position first. And if there's some competing products to look at, I would judge them against the standard. They are the standard in the industry, in my opinion. And there may be other, products in the offering that might be, maybe less expensive up front potentially. We find the pricing to be very competitive. It's very cost effective. It helps our bottom line. And Cortechs.ai has, the best reputation in the industry, in my opinion. And we've had a great relationship with them for, again, over 15 years. It's only strengthened with the more recent product releases and the continued updates in the software. So there have been constant software updates. So when you invest in a software as a service, you're basically investing in not just the support, which is really minimal because there's really very little need for support, but you're also investing in the product development, which is software development. And those investments are paying off. So NeuroQuant has improved over the years, and so has OnQ Prostate. There's no question that I would put Cortechs.ai in the leadership position regarding any decision to purchase any software as a service regarding AI, whether it's brain processing, prostate processing, what have you.